The country is a step closer to providing COVID shots to kids under 5, the only group still not eligible to be vaccinated against COVID-19.
Pfizer said its 3-dose vaccine for kids as young as 6 months is 80% effective, and the FDA will meet again to talk about it on June 15th.
And the U.S. is releasing doses of the monkeypox vaccine from the national stockpiles to try to contain an outbreak of that rare disease. As always, lots to discuss with UW Health's Chief Quality Officer, Dr. Jeff Pothof. Welcome back.
Hi, Dr. Pothof.
Good to see you guys.
Let's start off with monkeypox.
Sure.
What are we talking about here?
We hear about another virus, and it's scary after what we've been through.
Well, I think if you see the pictures, you're scared, and the name is pretty interesting. But monkeypox has been around for a long time, probably since the 1950s, usually in Africa. The virus is a relative of smallpox, but not nearly as dangerous and not as contagious. But we are starting to see these cases pop up. They're releasing this vaccine from the stockpile, but the vaccine is really old. So I think it'll be interesting to see if that's helpful or if it's even needed. But for the most part, I don't think folks need to worry too much about monkeypox right now. It's good for healthcare providers to be aware. We're on the lookout for this. We want to see if we see cases. But, you know, compared to COVID, this is small.
It's not COVID.
No. So you don't think this is likely to be another pandemic situation?
No, and I think, likewise. So for COVID, we used to say, 15 minutes in close proximity, 6 feet, and you could catch, COVID. With Omicron, it's probably in minutes. For monkeypox, you have to be in close proximity for like 3 hours to catch it. It's most often caught by being in close contact with someone who has pustules that you then contact. So it's not that easy to catch.
All right, let's talk about COVID shots for the small kids. 3 doses, that's a tall order for parents to deal with.
Yeah, I think you have to almost think of it as like, the 2 doses and then that booster like the rest of us. And that's because when Pfizer first did their study in kids, they tried to do the 2 doses and they found that the efficacy just wasn't there. It was unlikely the FDA would approve that. So they went ahead and added that 3rd dose. So now it almost comes out like a 3-dose series, like 2 shots and a booster, and they get similar efficacy, 80%, like you would expect from an adult who got vaccinated and boosted. So I think hearing 3 shots early on maybe seems like, whoa, but when you think about it, that's what most of us have already gotten as it pertains to our COVID vaccine.
When you say efficacy, you're talking about immune response?
Yeah, so this 80% number that you're going to hear about is the ability of that vaccine, 2 weeks after given, to prevent really any symptoms at all. So not just severe disease, but any symptoms at all. That's what we talk about with efficacy of these vaccines. So 80% is pretty good in the day and age of Omicron.
And then how soon do you think we could see shots in
So
arms?
I think they have that FDA meeting on the 15th. Usually with these kind of things, the CDC will sign off within a week. So I imagine by the time that happens and pharmacies and health systems get geared up, early July, you could see a vaccine available to administer to those 6-month to 5-year-old kids happening.
All right, we're a little short on time today because of all the breaking news, but I think we got a lot in as usual.
We did.
Deal.
Jeff,
Thanks, Dr. Pothof. Good to see you.
Good to see you too.